Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we're going to be talking about recommendations for a healthy pregnancy with board-certified obstetrician and gynecologist, Dr. Stacey Tremp. Dr. Tremp, thank you for joining us today.
Thank you for having me.
Now, as you're thinking about getting pregnant, what things should be taken into consideration?
Just a general healthy lifestyle more than anything. I do have a lot of patients who will come in for preconceptual counseling, and we want to make sure that their blood pressure is okay, that they're up to date in their PAP, and talk about their periods more than anything. Are they having regular periods? Are there any concerns with their periods at all?
So basically just keeping yourself healthy in general.
Yep, and they should start taking a prenatal vitamin daily, a few months before they're starting to get pregnant. And truthfully, a prenatal vitamin is a great thing for anybody of fertility age to take daily.
So once this woman takes a pregnancy test and it's positive, what is the next step?
I would have her call the office. So if she has an established OB-GYN, she should call the office and say, I have a positive test and I need to get in. If she knows her last menstrual period, that makes it really easy for us. And a lot of times women who are trying for pregnancy will be tracking those cycles. So we can say, I had a period this day. I think that I'm around 6 weeks pregnant. And typically offices will see that patient around 8 weeks of pregnancy unless they're having some problems.
So it's okay to coast through the first 8 weeks without having to see your doctor. There's nothing to worry about.
As long as they're feeling well and they're not having any issues. True. Of course, if they have any concerns at all, they should call us and let us know, and we can see them sooner.
So at their first appointment, what should they expect will be happening?
A lot of education, to tell you the truth. They usually meet with someone who goes over new OB instructions more than anything. So it's information about genetic screening that's optional but recommended for some ladies. There's a new test out that we can draw blood from the mom, and it's a really accurate genetic test itself. Some insurances are covering it, some are not, but it is an option. We do a smattering of blood work on mom. We want to know her blood type. We want to know her rubella status, her hepatitis status, if she's immune to those disorders. We want to make sure she's not anemic. If she hasn't had a regular PAP, we want to make sure that she has an updated PAP smear, make sure she's taking a prenatal vitamin, and then once again, that last menstrual period. Is she sure of her last menstrual period, or do we need to do an ultrasound to make sure we have a good due date for this pregnancy?
So you mentioned some of the lab work and the testing that needs to be done at the first trimester. What other testing needs to be done? Is there any other testing?
There isn't really any other testing at that first visit itself. We offer them genetic screening, and they can always decline. I think patients most likely would like it, but because of the insurance costs, sometimes decline it. And that physical exam also with their PAP test to make sure that everything is healthy to begin the pregnancy.
When would the first ultrasound typically be done?
If she knows her first day of her last menstrual period, it's not done until 20 weeks, which greatly disheartens most pregnant women. If you don't know the first day of your last menstrual period, then we try to get that ultrasound done sooner rather than later in the first trimester, so we can date the pregnancy and have an accurate gestational age.
So what changes could I expect to be happening to my body if I'm in my first trimester of pregnancy?
First trimester is one fraught with nausea, typically more than any kind of physical changes. People will notice nausea and vomiting that starts just after the sixth week of pregnancy. And there are a lot of over-the-counter things that they can do. B6 is something that has been shown to help with nausea. Unisom, believe it or not, has been shown to help with nausea. It does have that side effect of sleepiness, but those two taken together have been shown to help with nausea. You don't see a lot of physical changes. You just feel really fatigued and nauseous usually.
Are there any symptoms that would occur during the first trimester that would be concerning or abnormal?
Absolutely. So I always tell my patients when I see them for that first visit, if they experience bleeding and cramping like a period, that's concerning to me, and I would like them to proceed to the nearest ER at that point. That's concerning for miscarriage, and I want an ultrasound to make sure that things are either okay, or is there something that we need to do further for that patient.
Do women in their first trimester have to be concerned with weight gain or what they eat?
Absolutely. I think that during pregnancy you want to make sure that you have a healthy lifestyle, and that includes your diet itself. So fruits and vegetables, lean proteins are important. Weight gain in the first trimester isn't much because of the nausea. Most people don't gain a ton of weight, but we always want to keep that weight gain in mind as we're going through pregnancy, remembering that the weight that we place that we put on our body in pregnancy has to come off after we have that baby. So we want to make sure that we're eating healthy.
Doctor, this is great information. We need to take a break. We'll continue in a moment.
Thank you.